Hello, my name is Kamboj, and I'm a third-year internal medicine resident at Mayo Clinic, Rochester.
And I'm Cadman Leggett, consultant in the division of GI at Mayo.
Today, we will be discussing our manuscript titled Outcome of Endoscopic Mucosal Resection in Barrett's Esophagus Using Systematic Quantification of Epithelial Glands Using Volumetric Laser Endomicroscopy. We would like to begin by providing a quick overview of this technology.
Volumetric laser endomicroscopy is an advanced imaging modality used in Barrett's esophagus surveillance. It's a second-generation optical coherence tomography platform that measures the degree of infrared light backscattered from tissue. The image resolution is 7 micrometers, and the technology is capable of imaging to a depth of approximately 3 millimeters. This allows visualization of the mucosa as well as the submucosa in cross-section. The VLE imaging probe is centered by a balloon that comes in various sizes. The imaging probe rotates on its axis as it pulls back, generating a 360-degree image of the esophagus across 6 centimeters. Dr. Kamboj will now demonstrate how the VLE machine is used.
The VLE system consists of a console with a monitor and touchscreen. A hand controller is attached to the shaft of the gastroscope. The monitor displays a cross-sectional, longitudinal, and region of interest view across 1,200 frames. The balloon is deployed through the instrument channel and inflated in the distal esophagus before imaging. The balloon is compatible with channels 2.8 millimeters or larger. VLE imaging can be performed as an automatic or manual scan. If a region of interest is observed, this can be marked with 1 or 2 superficial laser marks for targeted biopsies.
We hypothesized that VLE could help with a more accurate estimation of lesion size. Atypical epithelial glands are one of the most salient VLE features associated with Barrett's dysplasia. We have previously demonstrated that a higher number of atypical glands is significantly associated with a diagnosis of dysplasia. For this study, we hypothesized the size of the lesion is proportional to the number of glands and that systematic gland quantification can be used to estimate the size of a lesion for resection.
To this end, we performed both manual and automated quantification of epithelial gland count and distribution using a database of endoscopic resection specimens imaged with VLE. We selected EMR specimens from lesions that were targeted for en bloc resection. In other words, lesions less than 2 centimeters in size removed with a single endoscopic resection. These specimens were imaged with VLE shortly after resection. We then systematically analyzed the number and distribution of glands in these specimens and compared outcomes between incomplete and complete resection specimens. Incomplete resection was defined by the presence of dysplasia at the lateral margins. We found that a higher number of epithelial glands and the presence of glands at the margins were measures that predict an incomplete resection using VLE. This is the first study to suggest that systematic quantification of a VLE feature can be used to estimate the outcome of endoscopic resection. Furthermore, computer-aided quantification tools may be applied to guide the endoscopist in estimating lesion size and resectability. In a clinical setting, piecemeal EMR, or rather ESD, could be considered for a Barrett's esophagus lesion imaged with VLE that is found to have a large number of epithelial glands or a large surface area occupied by glands. VLE with laser marking could then be used to outline the margins of the lesion by defining a region devoid of epithelial glands.
The automated software used to map out the gland distribution in this study was recently cleared by the FDA for in vivo use. The commercial name of this image enhancement software is Intelligent Real-Time Segmentation, or IRIS. The software provides an en-face view of the VLE scan with superimposed color maps for various VLE features, including glands. This will allow us to apply the methodology described in this study to further determine the role of this technology in endoscopic therapy in vivo. Thank you for your attention. We hope you have enjoyed this brief overview of VLE and Barrett's esophagus.